Are you tired of all those hair loss treatments and products that claim to work but don't? My name's William Gaunitz, and I am your no frills, no BS certified trichologist that is going to help you understand how to tackle your hair loss and actually regrow hair. Hello and welcome to another episode of the Trichologist Podcast. My name is William Gaunitz. I am a certified trichologist for over 22 years, and I am your no frills, no BS certified trichologist that's going to tell you essentially what's going on with hair loss. And today is an episode that, quite frankly, has been a very long time in the making. I took a little hiatus from making podcasts, and in that time, I actually learned quite a bit because there's a lot of things to learn in some of these items. So luckily, this is going to pick up where we left off and allowed for essentially you to get into growth stimulation, because this is going to give you a lot of information about growth stimulation that is a misconception of what people believe hair loss treatments are, because there's only three reasons for hair loss. There's DHT, there's nutrition, and then there's inflammation. And those are the core reasons. Now, how you treat that is another step. And growth stimulants today is what we're going to talk about. Growth stimulants are probably the things that you've heard about. Minoxidil, low-level laser therapy, microneedling, derma rolling, exosomes, PRP, stem cells. These are things that are growth stimulants. They don't actually do anything to block the underlying reason for the loss. They simply accelerate healing. They accelerate the division of cells. They accelerate your essential growth pattern in certain circumstances. But if you don't do this correctly, and the underlying reason for the loss is not mitigated, then A, it's not going to work as well, meaning that you may see no result. You may see a minimal result, or in some cases, I've seen people lose hair, like a lot of hair, with growth stimulation. And that's depending upon what your reason for hair loss is. So think about building a house on sand. You know, we could love that old analogy. And building a house on sand, it's like, oh, okay, well, it looks really nice until it just completely collapses. And when people use minoxidil, I particularly get this where they say, hey, I've been using minoxidil for 2 to 3 years and nothing's happened. And then they go off of it and then they lose a ton of hair. And then they go, well, maybe something was happening. And that's because minoxidil does inherently extend the growth cycle, and they may not have been getting worse because they've been on minoxidil, but their underlying condition was getting worse. They just didn't notice. And so then there's other people who are on all of the things that block the underlying reason for the loss. So let's just say they're on finasteride or DHT blockers. They have done their blood work and they have supported the nutrition for zinc, copper, vitamin D3, folate, B12, all that good stuff. And then they use growth stimulants on top of that. So they stop the progression of the loss. So they're on an even playing field. They have a solid foundation. And then they build on that, and they build on that by adding minoxidil or adding low-level laser therapy or adding PRP. When the clinics were like fully raging, that's exactly what we did. We blocked all the reasons for the loss. Use minoxidil, use PRP, low-level laser therapy, and you stack. And you get, when you're stacking, you get really amazing results, like mind-numbing, sort of miraculous style results. So you can go back in time a long way from how much hair you've been losing, meaning like if you've been losing hair for 5, 7, 10 years, if you stop the underlying loss and you build and you stack with growth stimulants, you're going to get a good result. But the trick is to do it right. So what we're going to talk about today is an overview of the growth stimulants, give you an idea of how that applies to the Gaunitz trichology method, which is what we've already discussed in the previous episodes of this podcast. And then I'm going to give you kind of a perfect protocol of what I think you could do if you had really severe hair loss and then you've mitigated the underlying reasons. again, are just going to touch on the key topics of the growth stimulations. In future episodes, we're going to go into really in-depth idiosyncrasies to each one of these topics, because I know a lot of people in the industry and they have insights and are experts more than I in the very key elements of these. But I'm going to tell you my experience and how to get from point A to point B. And if you are losing your hair, or if you are stuck and you want to try some different product, or if you really want to do it right and you want to get the best results possible, make sure you go to advancedtrichology.com, go and actually use my methodology, the Gaunitz Trichology method, and actually block the underlying reason for the loss so you can get the best results possible with the information I'm about to provide. And Advanced Trichology, go up in the top right-hand corner, and there should be a button there that you can just fill out a quiz and go through and process the information that is going to be amicable to your situation and is going to allow for you to understand what's going on with you and produce an output that is just for you so that you can actually get the results that you're looking for by blocking the underlying reasons for the loss. So definitely check that out and utilize Advanced Trichology to its fullest. So at the end of this podcast, I'm going to give you the perfect protocol. But if you would like that in written form, go ahead down in the show notes and just fill out that form, and we will send you the perfect protocol. And that is going to be very helpful for you. Obviously, I will run through it in this podcast verbally, but if you are a visual person like myself, you might want it written down. So go ahead, fill out that form, and we will send it directly to you. Let's get into growth stimulation, because quite frankly, so many people ask me about it, and I'm like, oh, I'm going to make an episode, and here finally we are. So let's do this. So growth stimulation is, again, the most confusing portion, I think, of the hair loss at treatment world. So again, you've heard of Minoxidil. Minoxidil started as a blood pressure drug back in the 80s. And then they all of a sudden discovered that it was extending the growth cycle of the hair on the body. And it's funny, I actually met a gentleman who worked on the study for Upjohn back before it was sold. But Upjohn was the original manufacturer of Rogaine, and they actually did all the studies. And this old guy in England, he had amazing hair, but he was talking about all the really cool things they were looking at underneath the microscope and underneath the analysis of essentially growing hair back in the 80s, where it was like, you can't grow hair. It's just something you have to live with. But in the 80s, Minoxidil was finally approved in 1988 for a topical that is going to elongate your growth cycle, and it's supposed to grow hair back, quote unquote. And to a degree, as long as you don't have any underlying sort of opposing force, this arm wrestling match that is trying to pull all of this down from the underlying cause, then it will extend the growth cycle. It will make those vellus hairs a little bit longer. It will add pigmentation to those hairs, and that can be great. And so it was one of the first things that I started using was Minoxidil. Actually worked really well for me back when I was like 17, when I first started losing my hair, and here I am at almost 46. So we have to, tip our hat to Minoxidil, because Minoxidil was the original growth stimulant, and a lot of people use it. So you're going to see it with all these different brands that are compounding Minoxidil with other things like finasteride, with other things like topical anti-inflammatories, or, topical zinc, or whatever it is. And Minoxidil is still very much in the market, and a lot of people start there, but it is a growth stimulant. So it is not blocking the underlying reason for the loss. A couple things about Minoxidil: if you're on it, once you start, you really can't stop. And that means if you're using it daily, you're going to pretty much have to use it daily. If you're using it twice daily, you're going to pretty much have to use it twice daily. And the reason for that is that your body is basically developing an equilibrium to that growth stimulant, and it is growing in synchronization with that application every day. So it is a great product. I fully support Minoxidil. I don't think you need 8 or 10% right out of the gate. You can certainly use 5%. And it is a great adjunct to the Gaunitz Trichology method, to blocking the underlying reason for the loss. And it is a great adjunct to other growth stimulants, which we were about to talk about: low-level laser therapy, PRP, some of these other things. But just know that there is a commitment to Minoxidil. And so it is going to just be something that you're going to do every day, like brushing your teeth, which is totally fine. So that is basically growth stimulant number one. And again, I like it. You can use it now orally. It's a really big deal. People are using it orally all the time. It does not work as well orally, in my opinion, as dramatically, I should say, than as it does directly on the top of your scalp. So if you apply it, a high percentage minoxidil, we'll call it 5%, could be 8, could be 10, directly to the areas on the scalp where you're losing hair, you're going to get a better velocity. You're going to get a better impact than taking, say, 1.25 milligrams orally or 2.5 milligrams orally on a daily basis. I have some people that do both. They take one low dose of minoxidil orally, and then they use minoxidil topically as well. But there are potentially side effects with that, which the side effects could be rapid heartbeat. They could be, swelling of the hands, swelling of the feet. Essentially, it's going to lower plausibly your blood pressure. It could also, make me a little dizzy, a little nauseous. But the purpose of this episode is how to use growth stimulants alongside basically blocking all the reasons for the loss. So assume that we have mitigated all the reasons for the loss by listening to all the previous episodes, and we're building on this. So minoxidil is a great daily application. You can also use it in association with other products like an advanced trichology topical product. Which actually advanced trichology doesn't use minoxidil, but you can apply a topical product and then put minoxidil on top of it. So you'd use like a thinner alcohol base on the top of your scalp, and then you'd go ahead and wait 5 minutes and then go ahead and put the minoxidil on top of that, about 1.5 milliliters of each. That's actually what I do. But that's minoxidil. So the next growth stimulant is low-level laser therapy. Now, low-level laser therapy, I've been using low-level laser therapy not only for myself, but in practice, essentially, for over 23 years. I started the only freestanding low-level laser therapy clinic in the United States back in 2002. So I have a tremendous amount of experience with low-level laser therapy. When we started out, low-level laser therapy had 12 diodes. That's it. I mean, it's a 12 diode device, and it spun in a what appeared to be almost like a hair dryer with lasers in it, and it spun, and it was great. And what it did was it basically just very gently stimulated your scalp. And that's what low-level laser therapy does. So it essentially provides a very specific wavelength of light. In this case, what we're talking about is light that is about 635 nanometers up to approximately 680 nanometers. And low-level laser therapy means it's a low-level laser, so that it's under 5 milliwatts, essentially. So you're taking this laser energy and you're pushing it into the scalp. Think of how sun affects the skin, right? You're radiating the scalp. And that's okay, because this is a healthful, anti-inflammatory energy to a point. Just like a little bit of sun is good, too much sun bad. So low-level laser therapy in very small quantities is very stimulative. A lot of the studies back in the day started with regenerating tissue from diabetic neuropathy on feet. So I worked with a company called Zirconia Medical back in the 2000s, and they were doing all sorts of revolutionary stuff with low-level laser therapy. So when you're thinking about low-level laser therapy, you have to think about using the right amount of energy. Because if you end up just diving into a really high level of energy, because nowadays low-level laser treatment is delivered by physicians selling you a cap most of the time, or seeing an advertisement on Instagram and then going to buy what is the most powerful laser cap. And rather than being 12 diodes, which is what we started out with back 20 plus years ago, now these things are 140 diodes, 180, 270, 300 diodes. And think about low-level laser therapy as, again, a very, very valuable tool. But just like you might want to take a medication, think of it like medication. Think of like if you're going to take a Tylenol for a headache, you're going to take one, maybe two, and that's it. You're not going to take the whole bottle. And you're certainly not going to take the whole bottle every single day and go, I wonder why I'm dead, because you've taken so much medication. So think about that when it comes to your hair, because low-level laser therapy is exactly like using a medication. If you're using way too much, your hair is going to shed. And when you lose that level of hair up front, if you have male pattern loss, the hair follicle shrinks, or female pattern loss, the hair follicle shrinks when it's resting. So when you kick out a bunch of hair, you're activating the shrinking of your hair follicles. So if that shedding is temporary, let's just say it's a couple weeks, no problem. If it's more like a couple months, I mean, I've had some people have been like, I've been on low-level laser therapy and I'm still shedding a year later because they're using some other device and it's way too much power. Then they have lost a lot of hair that's going to be trouble to get back. And you also can sensitize yourself to using too much low-level laser therapy. So I have multiple clients. They're very well off. They come to me. They've already treated themselves for a very long period of time. And they're like, I want to buy the best. So they went and they spent $3,000 or $5,000 on a 300 diode laser. And they've been wearing this on a daily basis for 6 minutes. And they go, I didn't really grow any hair. And I go, okay, well, you've overstimulated yourself. It's too much. And we have to remove some of it. We have to dial it back so your body can basically process this energy. In some cases, they shed, especially if they go cold turkey, because your body's gotten used to it. So they didn't grow any hair. Now their scalp is addicted, essentially, to this level of energy. And if we try to remove it, then they lose hair. It is a terrible process. So what you have to do is never, first of all, use a laser more than 80 diodes. It's just absolutely unnecessary. So most of the time, you're going to start out very, very small. You're going to start out at essentially an 80 diode laser for 10 minutes twice weekly. Do not go daily because there's an arc of effectiveness. This arc of effectiveness essentially means that, think of it like swinging a golf club or hitting a baseball. There's a sweet spot. You want to deliver the perfect amount of energy for you. You don't want to give it too much or too little. And when you go over the arc of effectiveness, you then negate its efficacy. There's a great article on Trichology.com. We can put it in the show notes below on exactly this topic. And this arc of effectiveness you need to basically hit it at the sweet spot at the top. When it goes too far, too much energy, then you're on the downswing, you negate its effectiveness. Then what's even worse is too much energy. You get past that, and now all of a sudden you're doing damage. It's like you've been out in the sun for 6 hours without sunscreen and you're wondering why your skin hurts. Well, it's because you've done too much. If you stopped at 15 or 30 minutes, it would have been a nice delivery of utilizing energy that your body could actually process. So you also want to give it approximately 48 to 72 hours. Your body needs to consume the energy that it's been provided. If you just keep feeding it over and over and over again, like if you're eating constantly all day, you're going to become full and you're going to get, not feel good. So allow your body time to digest the energy, 48 to 72 hours. Perfect protocol. You want to use low-level laser therapy in association with other growth stimulants, but twice weekly. Start it out 10 minutes. Do not exceed 10 minutes until such time as you've basically reached a place of about 90 days, and then you can bump it up to 15 minutes. And then after another 90 days, you can bump it up to 20 minutes. And at that point, if you're noticing growth, leave it there. 20 minutes, twice weekly. If you look at the research, there is no true research that is done on a 6-minute-a-day protocol, on a actual study that says that it is going to grow hair. All the studies that are recorded are done on low-level laser therapy at twice weekly intervals or 3 times weekly intervals with low-intensity lasers, either 80 diodes or I think there's one with 24 diodes and then approximately 50 LEDs, but essentially 80 diodes or less. And that has then been used by the laser companies to put an equivalency to file with the FDA for a 510(k) market clearance, which means they can say these protocols are as effective because they are quote unquote similar enough in the eyes of the FDA. And then they can get approval for that. And that is what's happened. And they will say, look, 300 diodes is better. So we're going to charge you $3,000 as opposed to selling you an 80 diode laser for $900 because they're making more money. Because quite frankly, I'm going to be very honest with you, the money is in the high value items because it costs nearly the same to make a 80 diode laser as it is to a 300 diode laser. You just pack more diodes in. It's the diode cost is not expensive. So it's a sad truth, but the physicians make more money and that is why they sell them. It is. And I'm sorry to all of my physician friends. It's true. So in this scenario, we have Minoxidil, great product. Use it daily. You don't have to because it's a commitment, but if you did, you can then also use that in association with low-level laser therapy twice weekly, right? So we're stacking. And at this point, if you just did that, Minoxidil and low-level laser therapy, your results could be extraordinary. And that's what I did in the clinics for like years. And it produced, we're talking 18 years essentially, and it produced amazing results while also blocking the underlying reasons for the loss. So there are three more that we're going to talk about. So we're going to talk about microneedling. We're going to talk about PRP. And we're going to talk a little bit about exosomes, stem cells. It's in the same wheelhouse a little bit, in my opinion, as PRP, but we're going to talk about that. So we've covered that. Do's and don'ts. Make sure if you're going to start topical minoxidil, keep using it. If you are going to use low-level laser therapy, start slow and don't buy a 300 diode laser. Please don't. Please, for your hair, just don't. So there we go. And mitigate all the underlying reasons for the loss before you even do growth stimulants. Microneedling. Everybody likes to talk about derma rolling. Everybody likes to talk about microneedling. I get it. There's a good study for microneedling and minoxidil, and it increases let me check my notes here. It is when using microneedling in association with minoxidil, it grew 4 times the new hair than minoxidil alone. It's talking about stacking, right? At the beginning of this. So on a 12-week trial, men who added weekly microneedling to minoxidil grew nearly 4 times the new hairs. So that is 91 new hairs versus 22. And this is on National Institute of Health.gov study. So essentially the combo approach dramatically outperformed solo medication alone. So we know there's a study that says it amplifies the results dramatically. So I'm going to explain what I've seen. People love to talk about derma rolling daily with use of minoxidil. My opinion, don't do it. Couple reasons why. One, the microneedling device to be effective needs to be approximately 1.5 millimeters deep. You have to pass through the epidermal layer. There are 3 layers to the skin predominantly. You got the epidermis, the dermis, and then the subcutaneous fat layer. There's more to that, but that's just the basics. When you are passing through the epidermis, which protects your body from the outside world, and you get into the dermal layer is where the top of the hair follicle lives. The little bottom of the hair follicle, when it's full, like a fully developed hair follicle, is actually down into the subcutaneous fat layer. So when you get down there, you are traumatizing the hair follicle on purpose. And the reason for it is that your body loves to heal from trauma. And to get through the epidermis, you need at least 1 millimeter. So you need to get down into the dermal layer, which is approximately 2 millimeters deep, but the epidermis can kind of range in depth. But to get down to 1.5 millimeters, you are going to hit the top of the dermal layer. And the dermal layer is going to go, ooh, ouch, what was that? And then it's going to flood all sorts of growth factors and stem cells back to the area to rehabilitate your scalp. And what lives in that area? The hair follicle. So you end up inadvertently getting the hair follicle to respond in a rehabilitatory type of situation. And that's why microneedling works. Now, again, let's talk about timing and frequency. You don't want to do this every day because your body needs to heal. It's got to repair itself. So it doesn't just magically repair itself like within 30 minutes. It takes time. So weekly microneedling is the appropriate level of microneedling. Anything more than that, you are potentially going to scar or traumatize the area too much. Again, we're talking about too much low-level laser therapy, bad. Too much microneedling, bad. Too much minoxidil, I mean, it's kind of hard to use too much minoxidil. Maybe orally would be bad. But you want to use that weekly. Now, I personally think that going to a certified individual who knows what they're doing with an actual microneedling pen, like a esthetician, cosmetologist who has a license to do so, and do it once a month is probably a better path where you're literally penetrating 1.5 millimeters or 2 millimeters into the scalp. It's a bloody mess. You get some lidocaine on your scalp or get some cooling gel, and then they just puncture away. That's probably the best path and the most efficacious. That's what we used to do in the clinics. And I think it worked out really well for a lot of people. But you can use potentially a derma rolling device and do the same thing. If it's not bleeding, you're probably not doing anything because you got to get through that dermal layer, or you got to into that dermal layer. So you got to get through the epidermis. And what happens when you get into the dermal layer? You bleed. So you should be bleeding. And if you're not bleeding, you're not getting deep enough. That's one issue, frequency. Second issue is if you are doing it at home with a derma roller, you need to be concerned, if you're penetrating into the dermal layer, you need to be concerned about sanitizing that derma roller. Because if you're not sanitizing that, and it's just say it's got some strain of staph on it, and you penetrate into the dermal layer, and now you've given yourself a staph infection. Like, I mean, it's pretty common sense, right? Like, you don't want to get into your bloodstream bacteria that can spread to your entire body and essentially kill you if it gets out of control. So that doesn't make any sense. So you need to sanitize it. And with that, again, how you can only give yourself so much pain, and do it correctly. So do yourself a favor, go to a licensed cosmetologist or a licensed esthetician. Go get a microneedling treatment on your scalp by a professional and do it once a month. And basically measure the results, see how it goes, and do it in association with low-level laser therapy. Do it in association with minoxidil. And again, we're going to talk about a perfect protocol at the end of this. So that's my tidbit on microneedling. I'm sure I will find an expert who can give me all the good stuff on this in the future. And we'll talk about it more in depth. But that's my opinion. I've seen it work tremendously well. I've used, again, microneedling, low-level laser therapy, and minoxidil and PRP in the clinics and had revolutionary results. So we'll talk about that here in just a second. PRP. PRP is a huge topic. Everybody loves to inject things into their scalp nowadays. At my office in Laguna Beach, I had some stuff. People are injecting minoxidil. They're injecting finasteride. They're injecting dutasteride. I don't understand what people are doing. Like, I mean, these are not good ideas. Let somebody else figure it out. And then when somebody has a study or a really good protocol, then do that. I haven't seen that work well at all on anybody. And then they come into me because they're shedding profusely, their scalp's traumatized. It's a big mess. Anyway, it has nothing to do with PRP, with the exception of PRP is an injection. So PRP, what is PRP? PRP is platelet-rich plasma. And I'm going to go back to my notes here so I can tell you a little bit more in great detail. So we used PRP in the clinics for a while. And I heard about PRP back in 2010. There was a physician down in Tampa who was doing PRP. So essentially what that means is you're drawing blood, usually 20 cc's, 40 cc's, and you are putting that blood into a centrifuge. The centrifuge spins it down. You are separating out the white and red blood cells, and you are separating the plasma into a separate area of the tube. If you allow that to sit, the platelets are heavier than the plasma, so the platelets float to the bottom. So then you've got this layer of what they call PPP, or platelet poor plasma, at the top. And then you've got at the bottom platelet-rich plasma. So that is plasma that has a lot of platelets, preferably for injecting into your scalp a minimum of 5 times baseline, or what's floating around in your blood. So that's the idea. So they siphon off the PPP, you're left with PRP, and then that's injected into the scalp. So the guys who I knew when I had my clinics in Arizona, they were flying to Tampa, Florida. They were getting these injections, and then they were coming back. And of course, I'm looking at their scalp under the microscope every 4 to 6 weeks, and I'm looking at their scalp, and I'm like, nothing's happening. Like, why? What's this big deal? They spent $3,000. They're down there getting this stuff. It doesn't work. I'm like, basically, I was thinking PRP just straight up doesn't work. And sadly, a lot of the way that a lot of people do it today, it's still not working. But if you do it correctly, then it will work. And so there is a gentleman, and I'm going to call him out, Dr. Jeffrey Rappaport in New Jersey. In my opinion, he is I'm going to go and say the godfather of the proper way to do PRP, because until I saw his methodology in practice, I didn't believe that it did anything. And we're going back circa 2014, 2015. And Dr. Brooke Blumetti, she, as a dermatologist, actually reached out to me, and she was like, hey, we should really look at this. There's a new way to do this, and it's better. And so the idea of doing PRP correctly it makes a lot of sense when you know kind of the way that the scalp works. And hopefully I can get Dr. Rappaport on here, and we can talk about this in great detail, and he can blow your mind with all sorts of cool stuff that he has much more knowledge on than I. And so essentially what's going to happen is that, again, we've already talked about the 3 layers. The PRP, you want to get into the scalp where the hair follicle is, right? And so what Dr. Jeffrey Rappaport decided is that we need to get more PRP to the subcutaneous fat layer. And we need to get a large volume, half a cc, essentially, to the subcutaneous fat layer. And we're going to bulk up that subcutaneous fat layer, and we're going to allow for the PRP to proliferate up into the dermis. And that will potentially work better. Sure enough, he was correct. It's also using a larger needle. So a way that a lot of people get PRP. Same process, they spin down the blood into the centrifuge, they suck off the PPP, and then all of a sudden they have a syringe filled with PRP, and it's being injected into the scalp. Well, a lot of people use little tiny Botox needles. So maybe get 40 or 50 injections, just every little shot, you're getting just a little tiny bit, like maybe, 0.2 cc's of the platelet-rich plasma into the dermal layer. Little shot, little shot, little shot, little shot. And they're using a Botox needle, which, might be a 13 gauge needle. And that, I think some people got lucky and maybe it worked for them. But that little tiny bit of PRP into the dermal layer isn't doing that much. And your body only has a very small window of opportunity to capitalize on that little extra growth factor that's right there. So if it's not really being utilized well, then it just basically dissolves into your skin and gets sucked up into your body and gets processed. So if it's not essentially directly impacting the hair follicle or the tissue around the hair follicle, then that's kind of what you get. One of the catches to this small level of using this little tiny needle is that sometimes the platelets coagulate. The platelets are big. And so when it's passing through this little tiny Botox needle and they get hung up, you might not actually be getting a large volume of platelets because they're actually coagulated inside the needle. And so when you're doing that, you need a much larger needle. And so you need a larger needle that you're definitely going to get all these platelets pushed into where you need it in the subcutaneous fat layer. So like a 22 gauge, much larger needle. And so with this, you are going to get a greater amount of growth factors to the area. Now, I also think that the subcutaneous fat layer has to play a role in the way that your hair follicles operate, because if you see somebody who's got a perfectly full, thick head of hair, the subcutaneous fat layer on their scalp is actually approximately 9 millimeters. So if you've ever seen somebody who shaves their head and they have a full head of hair, you can kind of tell that they have a full head of hair, even if they just did it and they don't have any 5 o'clock shadow or anything. But if you have somebody that shaves their head and they are bald, you can see that it's actually depressed in the area where they have lost hair, because the subcutaneous fat layer is thinner. It's about 2 millimeters. So you've lost basically 7 millimeters of subcutaneous fat between the fullest, thickest, healthiest hair and being bald. So if you imagine, you're shooting all of this PRP and growth factors into the subcutaneous fat layer, theoretically building the subcutaneous fat layer, making it thicker, then in theory, then that should make the hair thicker too. So you're not only getting to the follicle, you're getting to the dermal layer, you're getting it to the subcutaneous fat layer. So in my opinion, I think the subcutaneous fat layer matters. So hopefully we can get Dr. Rappaport on here and he can explain it in greater detail. But you want to use PRP typically every 4 to 6 weeks for approximately 3 to 4 sessions. And then at that 3 to 4 session mark, you can evaluate kind of what that PRP is doing, because it's essentially giving you all this extra growth stimulation and all this extra building blocks to get this momentum and rehabilitate these hair follicles from the resting phase. So let's hypothetically think you're doing Minoxidil, you're doing low-level laser therapy, you're doing microneedling, and then you're also doing PRP. Like huge stack, huge. I mean, I'm going to give you a case in point. There was a guy that came into my clinic in Arizona. We regrew almost all of his hair. We used low-level laser therapy, Minoxidil, all the supplements, some scalp massage. He went away. He went and got married. He ended up not caring about his hair anymore, ended up going off of all the products. Took him about 10 years to lose all of his hair essentially again. He showed back up into my office and he goes, I want to regrow my hair. I'm going, it's probably going to be really hard. We already did it once. To do it again is going to be really hard. I do not expect that you will get all of your hair back again. But we did all the supplements, low-level laser therapy, Minoxidil. I think we used higher percentage Minoxidil. I think we used 8% that time. We did microneedling after each PRP session. And he had, I think it was either 3 or 4 sessions by the pictures that you should be seeing now. And those basically grew all his hair back again, and which in my opinion would have been almost impossible, but it happened. So when you stack correctly, man, the results are incredible. So that's PRP. Again, you have to do it right. Larger needle, less injections, typically approximately, it could be 10, 12 injections, cover the area, and you're going to get good results. And you just have to get down to the subcutaneous fat layer. It hurts. It hurts a lot. So you're going to get a cooling mist and probably lidocaine, and you're going to coat the scalp, and it still hurts. When the big needle passes through your skin and into essentially the subcutaneous fat layer, it bounces off of the skull a little bit. That's how you know you're in the right spot. And then the nurse or whomever's doing it, the physician, will inject. And it does not feel good. But it works. So that's that. We're going to go into some stuff that I have less experience with, but I know enough-ish about exosomes. Again, I'm going to get some other people in here who know about the details, but I'm going to tell you my experience with exosomes. So exosomes are these little tiny messengers that are floating around in our body. And these, just so that I'm, very, very specific, they are going to indicate, they're little tiny messengers that are going to indicate to your stem cells what to do. So hypothetically, they are directing traffic to say, look, growth factors, stem cells, you need to do this. We need you to build hair. You could be building cartilage, bone, blood cells, whatever, but we want you to build hair follicles. So you find the exosomes that are specific to building the hair follicle. And what it's going to do when it's injected into your scalp, it is going to capitalize on the opportunity of those stem cells to then be directed to work towards building hair follicles. Now, again, I'm going to defer to Dr. Jeffrey Rappaport. I'm giving him a lot of plugs. I respect him quite a lot in this department. And he was using exosomes, and I sent some clients there because I had some very stubborn clients that you just couldn't. I'd been working with some of these people for years, and they just couldn't get over the hump. There was just something that wouldn't allow them to perform from a hair follicle perspective. So I remember one case, a female, sweet woman, early 30s, worked with her for maybe 5 years. She was up and down. She'd grow hair, lose hair, grow hair, lose hair. Sent her to Dr. Rappaport. She got a series of exosomes. I think she got 5 cc's throughout her entire scalp because she had diffuse thinning throughout the entire scalp. And she sent me her after photos, before and after. And it was remarkable. Like, she had grown 50% more hair in like 6 weeks. It was one of those things where you're like, really? Is this what's happening now? Because I've never seen it happen, and all of a sudden it happened. She happened to be lucky, I think, because I haven't seen that same type of result for others. But she responded really, really well. And she also got a ton of exosomes. I don't think people are in generally using that much anymore. The problem was she wasn't able to sustain it. So about 6 months later, 9 months later, it began to decrease. And I haven't heard from her in a long time. So don't know where she is currently, but that's kind of where things went. And now I do know that in a lot of cases, the general protocol with exosomes now would be to mix about 1 cc of exosomes in with PRP. And so then deliver it correctly to the scalp, obviously, put it where it needs to go. And in my opinion, microneedle immediately afterwards, for sure. And then you'd get to a place where you are going to have this, again, the messengers, the exosomes, telling the growth factors, which would be excessively in abundance in the PRP, as well as obviously in the local area, and then really get a result from that perspective. So I'd say use exosomes as a little bit of like, not a last resort, but maybe do an initial round of PRP and low-level laser therapy and minoxidil, and then go, you know what, let's just see how that goes, and then go to exosomes. Because that's the beautiful thing about growth stimulants is if you stack correctly, you will continue to build, in my opinion, to a degree. So the general rule is that you can go back in time approximately 3 to 5 years in most cases over the course of 2 years of treatment. And usually that involves minoxidil and low-level laser therapy, and then obviously mitigating the underlying reason for the loss, which is very key. So you got to get all your blood work, got to make sure there's not a whole lot of inflammation. You might have to change your diet, that type of thing. But when you add PRP, I feel like you have probably 3 rounds where you can then build to another level. Like, so if you could go back 5 years over the course of 2 years of treatment, maybe now when you add PRP, you can kind of go back 6 years. Maybe you add another round of PRP and you can go back 7 years. And so, because you're building little individual miniaturized hairs back to a more abundant place. I have a celebrity client, and guy's fitness whole thing. He had a result that is, he kept building hair over the years because he was so healthy. He ended up starting out base protocol, low-level laser therapy, minoxidil. He had some fancy stuff in his topicals. But he ended up building and going back 5 years, going back 6 years, going back 7 years, then presumably going on a PRP, Exosomes, and essentially has a full head of hair. I mean, it shouldn't have been possible. Like if you think about it in terms of where we were, 2006, 2007, but now there's so many injectables with stem cells that you can just basically keep building. That is kind of rounding out the entire process. Now there's new stuff. There's peptides, and there's the Alma TED, which is a device that is more of a delivery system. It's basically using sound waves to align the stratus corneum, the exterior of the epidermis, to essentially create a path for peptides to pass through. And there's been some decent results with that I've seen from colleagues. I've never seen it firsthand, but I've seen that it delivers similar results to, say, PRP on its own. So in my opinion, just do PRP. It's been around a little bit longer, makes a little bit more sense. It's using your own tissue. You don't have to use peptides. So that's kind of the nuts and bolts to where we're at. The perfect protocol. And again, to mitigate any questions, none of those do anything to fix nutritional problems. It's not going to fix low vitamin D. It's not going to fix low ferritin. It's not going to fix anemia or copper or low B12. It is not going to fix DHT. It is not going to mitigate the underlying reasons for the loss. It may moderately fix these symptoms, especially like inflammation. It may fix the symptoms temporarily. But eventually, the internal system will win. So you must tackle the internal system. I'm going to give you the perfect protocol. And that is, in my opinion, hypothetically, you're just trying to grow as much hair back as possible. When you're trying to grow as much hair back as possible, I'm going to walk you through just real quick the Gaunitz Trichology method. You need to essentially, if you, in a perfect world, you look at your scalp under a microscope, see where you're losing hair. But if you're losing hair on the top of the head, that is the vast majority of the time related to DHT. If you're losing hair on the sides or the nape of the neck, it's going to be nutritional or inflammatory. So by going through using the Gaunitz Trichology method, my methodology, you can use advanced trichology products to implement this protocol. Go ahead, block the DHT, whatever applies to you, block the DHT, add the nutrients back. So get to your blood work is perfect and mitigate the inflammation as much as possible. If there's itching, burning, scalp inflammation, you're going to need to use a topical application to put that down. Why my last episode was on inflammation. I'm going to continue to evolve the inflammatory protocol because that's what I'm working on more than anything else at this point in time. And you've mitigated all that. Now you can think, okay, what am I going to do next? Well, give it 3 months, stop the shedding with that initial protocol. And in my opinion, you would start with low-level laser therapy. It's the easiest. And so twice a week, start with low-level laser therapy. If you're like, well, I don't care. I throw everything at it. That would be sort of phase 1 perfect protocol, just add low-level laser therapy. If you want the next phase to that, add Minoxidil daily, 5%. Don't use propylene glycol if you can, because it's a scalp irritant. So get a propylene glycol-free Minoxidil and apply that on a nightly basis. If you're using another scalp tincture, then put that first scalp tincture down, wait 5 minutes, brush your teeth, do whatever you need to do, then apply the Minoxidil. Massage that in, let it sit, and cool. Try not to have your head hit the pillow for about 30 minutes to an hour so you don't rub off any of the product. The more hair you have, the more product you will need because it gets basically sucked up into the hair. I use a boatload of product. I use about 3 to 4 milliliters every night. It's my job. So that would be sort of like the next phase. So Minoxidil plus low-level laser therapy. Again, throw everything at me. Be like, okay. You can start Minoxidil and low-level laser therapy at the same time if you want. I would just tread lightly. And you can start PRP too. So essentially what you do is you build in a protocol. You're going to use the PRP, and you're going to use that on a essentially every 6-week basis and do the PRP correctly. And you're going to do that for 4 sessions. And so again, let's just say on day 1, you start low-level laser therapy. Say a week later, you start Minoxidil. And a week after that, you do a PRP session. Wait 6 weeks, do another PRP session. In a perfect world, you do microneedling immediately following your PRP session. If you say, well, it's great, I want the extra juice. Give me the extra stuff. This would not be what I would do. But theoretically, you could then add also exosomes to just 1 cc of exosomes to the PRP. At that point, do the 4 PRP sessions. That will bring you to 6 months. You will have been on Minoxidil, low-level laser therapy, PRP with microneedling and exosomes for 6 months, plus mitigating all the underlying reasons for the loss. At that point, you should have like an absurd amount of hair growing in, like just absurd. I've seen it. I would essentially say if you have an absurd amount of hair growing in that point in time, then you've got 2 paths, 2 schools of thought. One, keep going, but maybe, you'd increase low-level laser therapy a little bit. So you'd go from essentially 15 minutes twice weekly to 20 minutes twice weekly. I wouldn't go any higher than that. I'm going to do a whole thing on low-level laser therapy on why you need to be thinking about your hair color and your hair type, because light is attracted to pigment, and the darker your hair and the darker your skin, the less energy you require. So I'm just going to say cap it out at 20 minutes twice weekly and take that to 12 months. I would say maybe do 1 more round of PRP at, say 9 months with exosomes, and obviously maintain Minoxidil and maintain mitigating the underlying reason for the loss, and then see where you're at 12 months. 12 months, you may have considerably a full head of hair. I mean, depending on where you started. And essentially you could continue that protocol if you wanted to continue. Now, I would say after about 2 years, your body basically says, unless you're in perfect health, your body basically says, thank you for giving me all of these items to help regrow your hair, but I'm going to stop focusing on your hair at the moment. So I'm not going to build any more tissue. So at that point, that tissue is essentially at full maturity for what you can get back. And at that point, you're pretty much good, and you go into maintenance mode. Now, once you're at that point, the things you will have to maintain, most likely, you probably will not have to maintain PRP or exosomes or microneedling. Highest probability is not. You would wean off of low-level laser therapy. If you're going to wean off of anything, you wean off, and basically you cut it. As you went up, you go down, right? So if you're at twice weekly for 20 minutes, you're going to sort of progressively step down after 2 years. And so you'd go at 20 minutes twice weekly, you'd cut it down to once weekly for 20 minutes for 90 days. As long as there's no shedding, then you drop it down after that, another 90 days, cut that in half. So now you're doing essentially twice monthly for 20 minutes. And then make sure there's no shedding. As long as you're good, then you go down to once monthly for 20 minutes. And that's it. And then you can maintain that ongoing. Once monthly for 20 minutes, not a big deal. Minoxidil, keep using it daily. You just have to keep using it. It is what it is. It's fine. And then make sure you maintain the original treatment for mitigating the reasons for the loss. Make sure your blood work's in check. Make sure you're in good shape. And quite frankly, I've been at this 23 years. I've seen people, they still have all their hair or more hair now. And, either we're friends on Instagram or Facebook or whatever, and I see them. I'm like, oh man, you have so much hair. I remember when you were in your 20s. And, now they're in their mid 40s or whatever. And then, for myself, I've been bad. I have 2 different reasons for hair loss. So I battle male pattern hair loss, which is easy to tackle. It's the diffuse alopecia areata, which is a challenge. The wind blows sometimes and stress and whatever, and it likes to mess with hair. But I'm continuing to work on that. So that is it, right? So that is growth stimulants. It kind of sums up if you're trying to treat yourself where you're at and implement this correctly. And when you do it correctly, you're going to be successful. So I'm thanking you for listening. If you made it all the way through almost an hour of this information, I hope that you enjoyed it. Make sure that you go to advancedtrichology.com. Make sure that you go and fill out that quiz. Use Advanced Trichology to help block all of the underlying reasons for the loss so that you can then use these growth stimulants to build on top of blocking that loss. So again, advancedtrichology.com, utilizing my methodology, and it should be massively helpful, especially when if you just haven't done anything yet. This is the way to start. If you are in the process of trying to switch up your protocol to get better results, that is another place to go to, or just get the information that is actually true to the situation in today's day and age. Go to advancedtrichology.com. Also, please go ahead and obviously subscribe to this podcast. Go ahead and subscribe to my YouTube channel. Go ahead, if you wouldn't mind, leaving a comment, telling me that you love it, you hate it, whatever. If you are listening to this on any podcast platform, please go ahead and give me 5 stars if you like it. So hopefully you do. And we're going to keep coming out with more and more of this information. And we're going to keep having experts on here, and we're going to give you the information that you deserve, because quite frankly, you deserve to keep your hair. And there's only like the most minute of cases that is uncontrollable. And we're talking less than 1%. So the highest probability is you can get your hair back. And so that's what we do on this podcast. So thank you so much for listening. My name is William Gaunitz. I am the trichologist on the podcast, the trichologist. And I thank you for your time and look forward to seeing you on future episodes.